How do you induce vomiting in a dog? If you ever find yourself in a situation where your dog has eaten something harmful, you might wonder how to induce vomiting. This is a serious matter that requires careful consideration and professional guidance. Inducing vomiting, also known as emesis induction, is a procedure used mainly in emergencies when a dog ingests toxic substances. However, it should only be performed under the direction of a veterinarian. Improper induction can lead to more harm than good. When a dog vomits, it is the body's natural way of expelling unwanted substances from the stomach. In veterinary medicine, this process is controlled to help remove toxins before they can be absorbed into the body. The safest and most effective way to induce vomiting is through medications given by a veterinarian. One commonly used medication is apomorphine. This drug is typically administered by injection in a clinic setting and can induce vomiting in about 94% of dogs within approximately 15 minutes. Another option is the Food and Drug Administration-approved ropinirole ophthalmic solution, known as Clever. This medication is given as eye drops and can induce vomiting in around 95% of dogs within 30 minutes. If you are at home and a veterinarian has advised you to induce vomiting, the only safe substance to use is a 3% hydrogen peroxide solution. The recommended dosage is 1 teaspoon, which is equivalent to 5 milliliters, for every 10 pounds of the dog's body weight. You can use a syringe or turkey baster to squirt the hydrogen peroxide into the side of the dog's mouth, aiming for between the back teeth. This method helps reduce the risk of aspiration, which is when the substance accidentally enters the lungs. After giving the hydrogen peroxide, it is important to walk your dog for about 10 minutes. This can help the solution work effectively. If your dog does not vomit within 15 to 20 minutes, you may administer a second dose, but do not give more than 3 doses total. Always stay with your dog during this process to monitor for vomiting and any adverse reactions. There are important precautions to keep in mind. Do not induce vomiting if your dog has ingested corrosive substances, sharp objects, or petroleum products, as this could cause further injury. Additionally, avoid inducing vomiting if your dog is unconscious, having seizures, or showing signs of severe distress. Always contact a veterinarian or poison control center immediately if you suspect poisoning before attempting to induce vomiting. After the vomiting process, keep a close on your dog for any complications such as prolonged vomiting, diarrhea, lethargy, or signs of bloat. It is essential to follow up with veterinary care promptly to ensure your dog's safety and address any lingering effects from the toxin or the vomiting process. Inducing vomiting in dogs is a procedure best performed by professionals using appropriate medications. If necessary and recommended by a veterinarian, 3% hydrogen peroxide can be used safely at home with careful dosing and observation. Always prioritize immediate veterinary consultation to ensure the well-being of your furry friend.